Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're talking about prostate cancer. Our guest today is Dr. Dudley Seth Danoff. He is also the author of The Ultimate Guide to Male Sexual Health. Dr. Danoff is a graduate of Princeton University and Yale University Medical School. He has taught on the clinical faculty of UCLA School of Medicine for more than 25 years and is the founder and president of the prestigious Cedars-Sinai Tower Urology Medical Group in Los Angeles. Dudley, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Well, my pleasure, Jeanine. So I'm a resident of Nassau County. I went to Great Neck High School and grew up in Great Neck.
Oh, wow.
Before I went to Princeton.
Well, welcome back to Nassau County.
My pleasure.
So first, tell us more about you and why you wanted to specialize and why you do specialize in male sexual health.
Well, I am a mainstream urologist. I spend most of my waking days operating on patients with prostate, kidney, and bladder cancer. And a number of years ago, I got interested in male sexual health and realized there was a lot of misinformation out there. So I began to speak up. I wrote several books which got some notoriety and some popularity. And I have a new book out called The Ultimate Guide to Male Sexual Health, available everywhere. And been talking on the radio and making speeches around the world and saying, fellas, get with it. No woman would ever miss a year without her mammogram or a pap smear. And, our big, brave fellas, they don't want to get their prostates examined, and they don't want to get a PSA, and they don't want to get a digital rectal exam. And that's the way it happened.
That is the way it happened. So tell us more about prostate cancer being one of the most serious health problems. How big is this problem?
Well, it is very big. I mean, this year alone there'll be about 165,000 new cases of prostate cancer in the United States alone. Other than skin cancer, prostate cancer is the most common male malignancy. And it's the second leading cause of death from all tumors in men. So this is not an insignificant disease. Luckily, and with the early diagnosis of prostate cancer, we can prevent that from happening. But the key is early diagnosis. So what is the prostate's main role in the body? What does it do? So if you think of the urinary bladder as kind of a balloon upside down, in the pelvis just above the pubic bone, and the prostate is sort of like a donut or a collar around the neck of the balloon. So the purpose of the prostate is it supplies the seminal fluid. It doesn't supply the sperm, but it's the carrying fluid. So when a man ejaculates, the fluid that gets the little tadpoles in the right place comes from the prostate. And as a man gets older, the efficiency of the prostate decreases. And as a compensatory mechanism, the prostate gets larger. So this donut gets larger and the hole in the donut gets smaller. And it gets in the way of a man urinating. So he's getting up at night, he's dribbling, incomplete bladder emptying, thin and narrow urinary stream. So the purpose of the prostate, it's a sexual organ, but it's not involved with erections or libido or procreation. It's an organ which supplies the carrying fluid for the sperm.
So who is more predisposed to enlarged prostates and or cancer of the prostate?
Well, all men are at risk. You're predisposed, number one, if a male relative of yours has had prostate cancer. If one male relative has had prostate cancer, you're 30% more likely to get prostate cancer. 1 in 7 men in their lifetime in America will get prostate cancer. If you're an African American male, it is more likely that you will get prostate cancer. So we're recommending that everybody over 40 get an annual digital rectal exam and a screening blood test called a PSA. It's not the name of an airline. It's the name called prostate-specific antigen, which is produced by normal prostate, but it's produced by a cancerous prostate in a larger volume. So if you have an elevated PSA, that is a clue that you might have prostate cancer. Unfortunately, many things elevate a PSA, bowel movement, sexual activity, sitting on a hard bicycle seat, infection. But unfortunately, PSA is also elevated in the presence of prostate cancer. So it's gotten a little bit of a bad rap, but at the end of the day, it's the main tool that we physicians, urologists, have to make the early diagnosis of prostate cancer. And by making that diagnosis, we have a chance to cure our patients, either with surgery, watchful waiting, hormonal therapy. There's a great variety of nerve-preserving, potency-preserving, continence-preserving procedures that we can use.
So the PSA is blood work that is drawn from the male.
Correct.
Is that correct?
Correct.
Now, along with the
test.
PSA, what other kinds of exams? You mentioned a digital rectal exam.
Yes.
What does that entail?
Well, I mean, it sounds terrible, and it's not the most pleasant exam, but the examiner puts a glove on, a rubber glove, and he uses a digit. The digit is not a number, it's a finger, and it's inserted in the rectum. And the reason we do that is because the prostate anatomically is just in front of the rectum. So a skilled examiner can feel the prostate for consistency, for size, for asymmetry, for lumps or bumps or tenderness. So it is a very important examination, although unpleasant. It probably takes no longer than 15 seconds, but by a skilled examiner, it yields a lot of information.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're talking about prostate cancer and male sexual health with Dr. Dudley Seth Danoff, author of The Ultimate Guide to Male Sexual Health. So, Dr. Danoff, you just mentioned about the digital exam as well as the PSA. Are there any other type of diagnostic tests that can be done to diagnose prostate cancer?
Well, I mean, those are the two routine ones, but if a patient is suspected of having prostate cancer or he has an elevated PSA, we often use a screening MRI, which is an imaging study, and it gives us a picture of the prostate, and that might give us a clue. We sometimes use a CT, CAT scan. We sometimes use a transrectal ultrasound. So those are the three modalities. But the most common and the simplest, and of course the most economic one, is the screening PSA and the DRE, which is short for a digital rectal exam. Now, once we make the diagnosis, then we do more detailed diagnostic studies to see what the extent of the disease is and what the grade, or how aggressive is the disease. And then we design a custom-made treatment or a course of treatment for that particular patient. And that often today entails what we call watchful waiting or active surveillance, where these are so slow-growing a tumor that they really, we want our patients to die with prostate cancer, not of it, since everybody dies of something. So very often we put our patients in an active surveillance group, which we just watch the tumor. It's indolent. It doesn't go anywhere. It's not very aggressive. But there are a number of bad actors out there, and there are some very aggressive tumors, and those tumors require aggressive treatment. And the biggest breakthrough in the treatment in the aggressive treatment of aggressive prostate cancer is the use of the robot. So we now robotically and surgically remove the prostate without making any incision. It's done as an outpatient, hard to believe. It's nerve preserving, so that is preserving potency, we're preserving continence, and men are living longer, better, and healthier lives because of that. But it's a great, great breakthrough, technological breakthrough, the robotic technique.
You mentioned after being diagnosed with prostate cancer, this robotic surgery. Tell us about the CyberKnife.
Well, the CyberKnife is just another method of incision. It's very, very precise. We don't use it very, very much in prostate surgery today. But it might have some role in the future in which we can preserve the majority of the prostate gland and literally cut out that little portion of the gland that has the prostate cancer or the active disease. It's still in the experimental stage. I'm not recommending it as definitive treatment for prostate cancer, but it's certainly out there. The CyberKnife, laser treatment, focal heat therapy, focal cryo or freezing therapy. So there's a lot of modalities that are out there. Treatment with what we call HIFU, which is ultrasonic treatment. So there's a lot out there on the horizon, but I think there would be more experimental. And if I were a patient, I certainly, as a primary modality today, would not recommend that.
So, although there are a lot of alternate methods to surgically remove the prostate, you would go with the more traditional or the robotic surgery.
Well, the robotic is not so traditional. The old traditional was making a big incision,
right?
And it was a bloody operation. Mm-hmm. The prostate hides behind the pubic bone, so it's very, very deep in the body cavity. It's very hard to get to. And so the miracle of miracles was the robot. And I'm, as a surgeon, I'm ambidextrous, meaning I can use both hands pretty much equally. But with the robot, I can rotate my hand 360 degrees backwards, upside down. My visualization is increased 15 times. I see things in 3-dimension, all without making an incision.
Wow!
So it is a technological breakthrough. The most remarkable I've seen in my long professional lifetime. So there is a lot of things that we can tag on to the robotic technique, including CyberKnife and HIFU and all those other things that I mentioned. But the robot itself is just a remarkable technological leap forward.
So the male would go in the same day, have this surgery, the robotic surgery, and go
home in the evening and have a beer,
and go home in the evening with no kind of catheter, no kind of bleed.
He would need a catheter, a little rubber tube. So that would be the analogous to if you broke your arm and you needed a splint.
Okay,
we have to since we make an anastomosis, we have to line up the parts. So we do leave a catheter in for 4 or 5 days.
A urinary catheter.
A urinary catheter. But most men can wear it under a baggy pair of pants with a leg bag, and they can go, to their favorite restaurant or drive in a car. It's a truly remarkable, Jeanine.
So you're entering right into the meatus.
Right.
And you're going directly into to visualize the prostate. And what are you using? What tool are you using? Is it a screen that you're looking at, or describe to me?
So the robot goes like this. The robot surgeon, he sits at a console, which is at some distance from the operating table. And he's looking through a visual device that gives him a 3-dimensional view of the surgical field. And he's using an instrument called Intuitive. So he has 2 hand tools that he's moving back and forth and up and down and side and around, and a foot tool. And so he is controlling the arms of the robot.
Wow.
The robot has several arms. It has an arm that carries the camera, It has an arm that moves things around. It has the two surgical arms that the robotic surgeon is using, and then there's a second surgeon that's at the table side, and he's looking at a flat television screen, and he's controlling one or two of the arms. So it's really quite remarkable. It was developed by the Army for remote operation. So a soldier gets injured on the battlefield, and the field hospital is miles away. The robot is there at the battlefield site, and the robot surgeon is sitting, maybe 10 miles away, and actually operating on that patient with a field officer on site. So that's the history of the robot.
That's amazing.
And the progress has just been incredible.
That's right. So you can make incisions, and you can cauterize or do whatever you want by way of robot.
We do this through a little keyhole. It looks like the size of a quarter, and we put what's called a port, which is a little hollow tube, and it's through that tube that we insert these different instruments: the cauterizing, the cutting, the stapling. It's really remarkable.
That's amazing. Let's take a quick break. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and today we're talking about prostate cancer and male sexual health with Dr. Dudley Seth Danoff, author of The Ultimate Guide to Male Sexual Health. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Man, do I love card night. You ready, boys? You got a king?
Go, fish dad!
Oh, come on! This is WWE superstar Titus O'Neil. It only takes a moment to make a moment. Take time to be a dad today. Learn more at 877-4DAD-411 or visit fatherhood.gov.
Brought to you by the U.S. Department of Health and Human Services and the Ad Council.
We now return to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Welcome back. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're talking about prostate cancer and male sexual health with Dr. Dudley Seth Danoff, author of The Ultimate Guide to Male Sexual Health. So welcome back, Dr. Danoff.
Well, thank you, Jeanine.
So we talked about diagnosing prostate cancer and the surgical interventions for prostate cancer. Tell me, can this prostate cancer spread to other adjacent organs or other organs in the body?
Well, it can. Usually, if we can make the diagnosis early enough and institute effective treatment, that doesn't happen. But occasionally, men do not get their examination. The PSA is not noted to be elevated, and the cancer gets away. So if the cancer gets away from the prostate, the most likely place that it goes is to the bones. And when we do have cases of metastatic prostate cancer, it's almost always to the bones, and that can result in pathologic fractures, and it can be a miserable problem for the patient and very, very difficult to treat. Hopefully, with the diligence of your listening audience and their adherence to the advice of their physicians, they will not get to that stage where they will have to deal with bony metastases and pathologic fractures.
So the rectal digital exam begins at age 40 is recommended age.
And the PSA.
And the PSA. So how about younger than that for those that have a predisposition for?
It would be very rare. I mean, we have certainly seen some cases of prostate cancer, 36, 37, and 38. But that almost always happens in patients who have a male history. Family member who has been diagnosed with prostate cancer. So to be on the safe side, if you do have a male member who has prostate cancer, perhaps he should start getting these examinations at age 35. That's not a recommendation of the American Urologic Association, but it's like chicken soup. It wouldn't hurt, and it's a bit like suspenders and a belt to keep your pants up. But I have certainly been shocked at the early age at which I have diagnosed male members of a family who had a previous member of that family with prostate cancer. So 40 in general, maybe a little bit earlier if you have that positive family history.
So with the prostate surgery, is there ever a combination of chemo or radiation that's done sort of like adjuvant to the surgery?
Yeah, that's a very good question, Jeanine. So once the surgeon has removed the prostate, he turns the specimen over to the pathologist who looks at the slides and looks at the microscopic nature of the tumor. And if the tumor has gone beyond the capsule of the prostate, that sometimes the surgeon can't see that, it could be microscopic, or there is involvement of adjacent lymph nodes, that would require additional treatment. And sometimes we use hormonal therapy to block the synthesis of testosterone. So testosterone is the male hormone, the hormone that drives your libido, that gives you muscles. But it also fertilizes prostate cancer. So one of the treatments is to ablate the presence of prostate cancer, and we give a medicine which blocks the synthesis. It's a chemical castration, if you like. We also use adjuvant radiation therapy. We use image-modulated radiation therapy, which is called IMRT, and it delivers a very precise beam of radiation to the area of interest without injuring adjacent organs such as the rectum or adjacent bowel or lymph nodes or nerves. So occasionally we do have to be more aggressive, depending on how aggressive the tumor is.
So once you have diagnosed the prostate cancer, could this disease process or enlarged prostate affect a man's ability to maintain or to achieve an erection?
Yes, I mean, that's the great fear of most men. And with the robotic technique in which everything is magnified and we have this tremendous skill to be able to preserve the nerves of potency, almost all men who need this kind of robotic surgery for an aggressive tumor are left with full sexuality. They can get an erection adequate to penetrate. They can reach orgasm. The only difference is that because we removed the prostate, when the man does have an orgasm, little, if any, fluid comes out. But that's about the only downside to it. So this great fear of impotence and incontinence in a skilled surgeon's hand, it practically is non-existent.
It's almost null that the male can achieve still his sexual health.
Pick your surgeon wisely.
Yeah. And I would imagine that when you talk about the role of the seminal fluid with the prostate, is that male also able to have children after having the prostate removed?
No, the problem with that is he can't deliver the sperm. So
right.
It is. If we see prostate cancer in a younger man and he's desirous of having children, we advise him to bank his sperm. In other words, make a deposit or 2 or 3 in the so-called sperm bank, so that his sperm can be inseminated into his partner, when the time is right. So we often run into that problem, and that's the way we deal with it.
So I'm looking at your book, and it has some of everything that you want to know about male sexual health. And I'm looking at your chapter 6, where it talks about you're not alone, and it talks about the pump and the implants for those that are having problems achieving it, male that are having problems achieving an erection. Tell me about that. Is there a need for the pump?
So, that's kind of the court of last resort. So we have, an aging population. We have people, living longer, jumping higher, running faster. And, they're running out of steam in terms of their sexuality, atherosclerosis, hypertension, diabetes. And certainly in the older population, it becomes more and more difficult to, get and maintain an erection. So first we have the magic pills, Cialis, Levitra, Viagra, and those have really pushed the envelope. We also have injection therapy, in which we can inject what we call a vasoactive substance into the penis, into the side of the penis, which creates increased blood flow. But when all else fails, we have the implant, which is very analogous to an implant in a woman's breast. We use some cylinders, and we transfer fluid from a reservoir to the cylinders, so that when the erect penis is required, we fill up the cylinders. When we want a flaccid penis, we take the fluid out of the cylinders. So it's a very, very complex but very effective treatment, but it is definitely the treatment of last resort for male impotence.
So what you're seeing in your office, or what you're seeing mostly, what is the method of choice for erectile dysfunction?
Oh, by far, Cialis. The $1 billion drug. So older men take it because it's very effective in increasing blood flow. So it is not a drug of desire. It's a drug of performance.
Okay.
It just increases blood flow. A lot of the younger fellows are taking it to be the weekend warrior. They can abuse it. We have to caution them about that. But that's by far, my gosh, that's off the charts. I wish I bought stock in that company.
Wow, me too. Me too. Are we seeing more of a predisposition for sexually transmitted illnesses because of these erectile dysfunction medications?
Yeah, obviously. Yeah. The more active people are, the more opportunity for carelessness. I mean, we emphasize what two adults do behind closed doors is their own business, and all we beg and plead is that they practice safe sex.
Yeah.
Now with the HIV drugs, almost doing away with the need for safe sex, people are getting careless, and the incidence of STDs are increasing.
Yeah.
So I beg all listeners, no matter what you do, no matter what your practice is, safe sex.
So how can we get your book? I mean, this book is amazing. I think it has some of everything.
Well, it's online. It's in Amazon. It's in all the bookstores.
Do you have a website?
Yes, I do. It's called The Ultimate Guide to Men's Health.com. So, The Ultimate Guide to Men's Health.com.
So we talked about prostate cancer. We kind of move through everything here. What would you say in general about men being responsible, maintaining their sexual activity, but being responsible? And you kind of touched on it already, but I guess this being responsible starts in a very young age, as well as to the older adult population. What would you say in general?
Absolutely, Jeanine. And I talk about that a lot in my book. I mean, the father has to teach his son, and in the absence of a father figure, the mother has to teach the son about caring, about loving, about doing unto others as you would have them do to you, about kindness, about gentleness, about responsibility. I mean, the greatest aphrodisiac is love itself. It's not Cialis or Viagra. Mm-hmm. So those are things that should be, taught to a child at a very, very, very young age. The book is funny. It's tongue in cheek. It's medically accurate. So I think it's very well overdue, and I think that it takes a lot of the stereotypic myths away from what we would hear, mainstream language, but it brings a nice informative touch to the population for those that read it. So thank you for being here, Dr. Dudley Seth Danoff. It was my pleasure.
Yes, author of The Ultimate Guide to Male Sexual Health. This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, and we thank you, our listening audience, for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.